Okay. Hi, good evening, friends. Thank you for joining us live if you're here, and thank you for joining us at a later date if you're watching us on our recorded version. We appreciate it and your support. Tonight, we're really excited to have Dr. Kiana Berry or Dr. Kiana Berry Brown here with us tonight. I got the pleasure of meeting her at CSM this year, and she is phenomenal and has amazing energy. We're really excited to have her in tonight. She is going to be presenting a webinar on reclaiming body and faith, the impact of religious trauma and pelvic health. So welcome, Dr. Kiana. So I'll just turn the floor over to you and let you tell us a little bit about yourself and some of the great things you're doing, and then we can get to the fun stuff.
Yes, yes. And yeah, you're right. Kiana Berry Brown. I haven't changed my last name just yet. Lots of paperwork for that. Um, but yeah, I'm so excited and happy to be here, especially talking about such a complex topic as religious trauma and how it impacts the pelvic floor. I think that is something that's not talked about enough or researched enough, and it impacts our health in such a deep, profound way. I think it's very important that we talk about this and that pelvic floor therapists are also informed on how to address this with their clients. And also for the people and the students who are listening who aren't in the healthcare field and just want to learn about their bodies, I think it's so important that you're empowered with accurate knowledge and an understanding on how to actually reclaim your body. So if you see the title, so straightforward. I like to be straightforward. Reclaiming your body and your faith. I think a lot of times when we think about our health, our pelvic health, our sexual health, we don't always like to put faith and that together. But I honestly think that it's so important that we address how they are connected and how they can impact each other. So we're going to go to the next slide. Oh, a little bit about me. You don't have to read all of that. But just know that I'm a board certified physical therapist, author, speaker. I've grown a community of so many individuals who are happy and seeking to empower themselves with knowledge and education. And I'm really passionate about this because not only do I treat it on a daily basis, but I was also once a person who had pelvic floor issues and their religious trauma impacted it. So it's something that I hold very dear to my heart. And I also love to be able to share that with other people so that they know that they're not alone and they don't have to suffer in silence. Here's a little bit of a snapshot about me. If you want to learn a little bit more about me, you can go on my social media handle, on my website. I have 2 ebooks, and I'm a speaker. I'm also a business owner, influencer. And I just really, I love what I do, and I love all these little titles, but I'm just me, and I'm the person that can help you understand you and your body better. My biggest thing is that I want you to not need me. I want you to be able to understand your body, know exactly how to move forward, know exactly how to step into the room, be the smartest person in the room when it comes to your body and what's going on with yourself. So I'm such an advocate, and I love when people are able to advocate for themselves. So let's jump right into it. All right. So let's talk about what we're going to explore. As you can see, we have like a few tabs we're going to go into. Understanding what religious trauma even is, how it affects our pelvic floor and our pelvic health, pathways to actually heal, because we can talk a lot about what's wrong and what's going on, but how do we actually take that step and move forward? And that's going to lead right into our next steps, how you can actually make actionable change. So first, we're going to go ahead and dive into, can we like actually understand what religious trauma is? When we talk about trauma, a lot of people don't like putting themselves in that category because, it could always be worse for someone. But it's really important to not gaslight yourself into thinking that maybe it might be worse for my specific body and my specific nervous system. So you don't have to write off your experiences because someone might have it a little bit worse. Okay, you can give yourself space to be able to heal. Let's go ahead and go into the first section. Let me know if I'm going a little too fast. All right. Religious trauma impacts the pelvic floor. That is a statement. And a lot of people, they can say, well, yeah, it could in theory, but let's actually break it down into how it actually impacts the pelvic floor, even whenever you don't even realize it. So there are a lot of harmful religious teachings, experiences, or institutions that can lead to emotional or psychological distress. Let's put a disclaimer here. We have to understand that religion in itself does not have to be harmful. But when there are teachings that can lead you to an emotional, psychological, distressing response, that's something that we need to note. Okay? All right. Now, when we go into this emotional and psychological, distress triggered distress response, this can manifest in a lot of ways. It can manifest as anxiety, shame, dissociation. We're going to talk a little bit about what dissociation is, and physical symptoms. When we discuss physical symptoms or psychological, emotional that manifests into physical symptoms, we're going to call that a psychosomatic response. So if you see me talking about that, when I say psychosomatic response, I'm really just talking about how an emotional and psychological trigger can lead to an actual physical response. All right. The impact of religious trauma directly influences the body due to the way trauma is actually stored in our nervous system. Now, most people don't really understand how trauma is actually stored in your body. We like to say it a lot, but by the end of this presentation, I want you to really understand how our nervous system handles trauma, handles sensations, the normal and the not so normal. Okay. Religious beliefs, teachings, and experiences as a whole can deeply shape our relationship with our bodies, whether that's positively or negatively. It's so important that those beliefs that we hold subconsciously or consciously will absolutely impact how we view reality, how we view our body, and how our body responds to outside sources or outside sensations or experiences. So the goal for this presentation is to bring awareness, link religious trauma and pelvic health, and not only that, but validate experiences for those who have been impacted, or may not even know that they've been impacted. Let's go on to the next one. All right, so here's the word, religious trauma syndrome. It sounds kind of intimidating, actually. So we just pushed it together and said RTS. Um, religious trauma syndrome, it's not a diagnosable thing. It's kind of like a collection of experiences. And we use this term to describe the psychological and emotional distress, the experiences that we have in individuals that have been harmful to our emotional and psychological states, fear-based, or we might be in an environment that has a lot of controlling religious beliefs and practices. Now, it's so important to know that there can be a spectrum with this, but trauma is trauma, and your body can't really tell the difference or compare trauma with another person because you are driving the boat. It's you. Let's go on to the next one. Oh, and also to note that not every environment or religious institution actually presents harmful beliefs or teachings. It can come from outside sources as well. So we're not attacking religion. We're just describing how harmful beliefs, or if we take in belief systems or take in messages that are negative, and we actually create a core belief outside of religion, this is how it's going to affect our body. So let's go ahead and move on with that. All right, I want everyone to read this. Religious trauma shares, or RTS, shares similarities with PTSD and complex trauma. So oftentimes, we don't always just label it as religious trauma. Religious trauma is a category that can kind of go into the PTSD or complex trauma or feed into it. Can result from experiences such as spiritual abuse, high control religious environments, purity culture, excommunication. And it's not so much just religious institutions, it can also be people. Humans are not perfect. And even if you're in a religious institution where, the message is pure and true, you can't really control how you interact with imperfect humans. So, interactions with people can also feed into that high control religious environment. So, it's not just the religious institution itself, it could also be the people that are in that institution in that very unique environment. Okay, let's dive into the science and the impact on emotional and mental health. Now, the reason why we're diving into this is because there's something that all pelvic floor physical therapists should understand, and that is trauma informed care or trauma informed therapy. That is something that is huge. Now, unfortunately, women have not always been in studies, research studies, peer reviewed articles. They have not always been studied, even though women make up more than half of the world population. Oftentimes, in old medical textbooks, the anatomy is based on male anatomy or male physiological experiences, right? So it's so important that we understand that the mental emotional health is just as important as the physical health. And it can impact the body through psychosomatic responses. So that's that word again, psychosomatic. Just remember that when I talk about psychosomatic, it's how the psychological or emotional factors impact or lead to physical responses. So the body and mind are very much connected, right? For instance, if I pick this up, yes, my hand grabbed and picked it up, but my mind and my central nervous system commanded me to do it. So you can't take away one from the other. They will impact each other very, very deeply. So let's go ahead and jump into these categories here. All right, so RTS, or religious trauma syndrome, can profoundly shape a person's sense of self, their relationships, and the connection to their own body. Okay, now, how can this impact our mental emotional health, chronic anxiety, and fear? Now, when we talk about chronic anxiety and fear, a lot of times everyone says, just relax. And that makes everyone so upset. Like, what do you mean? I can't. My body is just geared and riled up. Now, some people may not even sense that they are in a heightened or chronic anxious state at all. So, we're going to also talk about how to kind of notice those things. All right, individuals may struggle with deep-seated fear of punishment, eternal damnation. I'm sure some of you have heard about, oh, will your soul be damned to hell? It's such a violent and sad and scary thing, and it really can lead to negative beliefs about our body. Rejection, and this can lead to a persistent anxiety and hypervigilance. Hypervigilance, I can describe, let's make an illustration. Someone who has been told, if you wear a short skirt, you are going to lead people to sin and therefore you are sinning. So a hypervigilant response could be, I have to not only make sure that I'm covered, but if I see someone else who is uncovered, I need to also tell them. I need to also make sure that even if I have a long skirt, that I behave myself in a way, and domino effect. If you have experienced that before, I'm so sorry. And I want you to know that that wasn't really fair to you. Let's go ahead and move on to the second one, guilt and shame. Guilt and shame is such an intense and really violent emotional response to the body. Um, Teachings can emphasize sinfulness, unworthiness, or bodily control, and it can create internalized shame, especially around your sexuality, your self-expression, and bodily autonomy. And I think that we could talk for hours about this specific category. Um, but guilt and shame actually create such a strong psychosomatic response in our bodies. We can't not notice it and we can't not address it either. So it's probably one of the strongest emotional responses that can lead to a psychosomatic response when it comes to religious trauma. And the third one, the one that we're just so good at, emotional suppression and dissociation. And there's that word again, dissociation. All right, so we're going to read this together. Suppression of emotions in favor of obedience can lead to detachment from one's own feelings and difficulty processing emotion in a healthy way. It's really, really important to know that emotional suppression dissociation can look like we never talked about sex in this household, and we never talked about feelings in this household either. So that's something that a lot of people may relate to. That can be a form of emotional suppression because you're not able to verbalize it, express your feelings around it, because there wasn't a safe space to actually talk and converse about something that happens to all of humanity. And I think it's very important to note that because oftentimes our emotions can be so suppressed and we can be dissociated or not connected to them for such a long time that we don't even know we're doing it. We don't even realize that they are suppressed. And oftentimes, when we suppress an emotion or emotion we deem negative, bad, shameful, wrong, or dangerous, when we suppress that, they can get triggered very, very easily because our body and our central nervous system really, really wants to process through those emotions. And when they don't get the ability to, they sometimes lock them away. When they get triggered, they can come out pretty violently. When I say violently, they can come out in a way where you have a very large emotional response. And that can be kind of scary. And the first thing that we would want to do sometimes when something's scary is suppress it again, run away from it, or distract ourselves. So we're not going to do that here. We're actually going to talk about it. Let's go to the second slide. All right, here's a few more. Body dissociation and somatic symptoms, relational challenges, difficulty with decision making. So we're going to break that down really quickly because I know I have a few more slides. But body dissociation. So we kind of talked a little bit about this when we talked about emotional suppression, but the trauma from restrictive or harmful religious teachings can manifest physically. This can contribute to chronic pain, muscle tension, digestive issues, and other stress-related disorders. One being even rashes or hives. That can be an actual response or somatic response to stress. Okay, sometimes our body, our central nervous system, our brain, doesn't allow us to feel or actually experience those emotions. So when we suppress them, they have to come out somewhere. And sometimes they can come out physically through chronic pain, muscle tension and guarding, and our digestive issues coming up. And that can be like IBS. So oftentimes IBS is associated a lot with pelvic floor disorders. Relational challenges. All right. So, religious trauma can deeply affect our relationships, leading to feelings of isolation, that suffering in silence, disconnection. I'm not able to talk about what's really going on with me because it is shameful. It is something that makes me feel embarrassed. I don't really want to experience those negative emotions. So, I think I'm just going to pretend they don't exist. And if something comes up in my relationship, it's probably just my fault. And now I just feel guilty again. So it's a cycle. And I'm so sorry if you relate to what I'm saying because that's so unfortunate, sad, and just unfair. And I need you to know that you're not broken. And this is something that you have the power to change. Okay? Ingrained beliefs about purity culture, sin, or bodily shame may hinder a healthy intimacy, may hinder deep connections with individuals. Because if you're not able to even connect with yourself, and connect with your own emotions. It may be very difficult to be able to empathize or relate to someone else because that requires vulnerability. And if we are in a constant state of shame, guilt, fear, embarrassment, being vulnerable is probably the last thing on your list because that's going to allow you to experience all those feelings with another person. And that can be kind of scary. Difficulty with decision making. Oh, and just to note, relationship challenges can come or show up psychosomatically, like vaginismus. And we're going to talk a little bit about that later. All right, difficulty with decision making. This is something I added because we don't talk about it enough. When we are in a environment where there are very strict rules, authoritarian religious settings, or when there's a control-based relationship with your peers in this religious setting, it's very difficult to trust your own decision making because you don't have autonomy. Now, this is not saying for everyone across the board, but this is something that should be talked about because having autonomy, trusting yourself also takes a little bit of vulnerability. It takes the ability to be present and takes the ability to understand what's going on in your body. So that can also restrict your own autonomy. Um, so yes, and I also wanted to add this. It's hard to trust themselves because they fear they will make the wrong choice without an external validation from their peers, from their religious requirements, from their traditional requirements that they have deemed religious in nature. And so that can put a lot of pressure on you, and you don't want to make the wrong decision. Now, this is not across the board. This is just something that we have seen when it comes to religious trauma syndrome. All right, so before we dive into the pelvic floor, let's just have a refresher on what it even is, because there's some people here who might not know. There's some people who really understand what this is. So we have our pelvic floor, this red that's connected to the pubic bone here, and we see all of these organs that are being supported by it. Our uterus, our bladder, our rectum, and here's our vaginal canal, here's our urethra, our anus here. If you didn't have a pelvic floor, you would all but fall out. So it's very important. And if you are spiritual and you believe in God, He made that. God made that thing to support your body, your internal organs. He made it very intricately. So it is actually incredibly important for your body. It's a group of muscles, ligaments, connective tissue, and nerves. And that's something I forgot to put there. But oh, yes, I put it there, nerves. That's very important when we talk about our nervous system and how it's connected to religious trauma. Okay. I'm going to go ahead, go to the next one. And if you're watching this and it's recorded, just pause and just take this all in because it's such a beautiful, beautiful diagram. And I drew this, just want to add, I drew this. I'm very proud of myself. All right, thank you. So we're going to go to the next one. Jump scare. No, I'm just kidding. This is our vulva. And I also drew this. I'm very proud of this too. I would honestly, if you have a vulva, even if you don't, draw it. Draw the vulva so that you can understand what's going on there. Just like we know we have 5 fingers and 10 in all, we need to understand what this is. This is a part of our body. And one of the biggest things that we need is to educate and empower ourselves with accurate knowledge. So draw this out and understand what each one means. So it's the external part of the female genitalia, comprising visible structures that play a crucial role in sexual pleasure and protecting the inner organs. So this is a beautifully and wonderfully made piece of art that everyone who owns a vulva gets to walk around with. So I think that you should also take a mirror and look at it if you own one and say hi. All right, get off my soapbox. Let's go to the next one. Okay, so why does it matter? Pelvic floor gives us stability. It helps with our bowel and bladder, our functions, and also helps with sexual health. All of these are so important, and you use these daily, weekly, all the time. There's not 1 second that your pelvic floor isn't being used in some way. So it does matter so much for you. So let's go ahead and go to the next slide. If you want to take a look, just pause. All right, let's jump into the nitty gritty. So the effects of religious trauma on pelvic health. All right, and I misspelled this, so apologies. The mind-body connection plays a crucial role in pelvic function. And unresolved trauma from religious teachings can manifest physically in many various ways. So that psychosomatic response we talked about. This person's so sad. They're getting comforted by their friends. They realize they're not alone. All right, I love this slide. It has so much information on it. So we're gonna break this down. I could have made this slide so much bigger, but I had to stop myself. um, the brain-pelvis connection, how trauma shapes pelvic health. So there's a lot of words in this. So we're going to talk about it. The central nervous system. When you think central nervous system, I want you to think brain, spinal cord, brain, spinal cord, right? Autonomic nervous system. You don't even have to worry about that. It happens automatically. And pelvic floor muscles communicate bidirectionally. So what does that mean? Our central nervous system influences the pelvic floor, and the pelvic floor influences the central nervous system. So they talk to each other all the time. Even when you don't even think about it, they're talking to each other. All right, so we have part of the brain, the amygdala. It's the fear center of the brain. So if you want to be the smartest person in the room, ask somebody, do you know what the amygdala is? And you can tell them it's the fear center of the brain. Now, when we have stored unprocessed trauma, whether it's religious in nature or not, the amygdala can become very hyperactive. It's constantly looking for threats in the background. So our subconscious is always in the background looking for threats. Those threats can look like sensations. Sensations, I need you to really listen to this. Sensations are physical sensations, emotional sensations, psychological sensations, and I like to add memories there because memories can trigger those as well. So when we talk about threats, we're really just talking about sensations that we have tagged bad, wrong, get out of here. And that can be guilt, fear, shame around bodily functions and genitals. Now, when we constantly get these triggers, it keeps our body in a state of fight or flight. And fight or flight is, I think everyone's heard the phrase, if you see a bear, you're going to run or you're going to fight it. You're going to get that adrenaline rush. Now, when we are constantly getting these threats through our subconscious and our body, our central nervous system, does not have the chance to actually process them correctly, it will keep us in a state of fight or flight, and that can lead to chronic pelvic tension. When we get into fight or flight, we're ready. Everything's tight and ready to go. My fists are up, my heart's racing, and those pelvic muscles tense up just to be ready for whatever's coming at it. Now, there might not be a bear on the I-10. It might just be you driving and you getting triggered, but your body doesn't really know that. So it's going to be ready to protect you. All right, cortisol and adrenaline, those fight or flight hormones, those things rush through your body. Those elements or that fight or flight response can increase pelvic floor tension. And it can also lead to straining because it's so tense. This can also, unfortunately, lead to a suppression of sexual arousal, and it can also disrupt your hormonal cycle. And that's something we don't want. Um, I want to kind of note something that a theme that I've really seen when it comes to religious trauma, especially with women who have vaginismus. A lot of times the messaging that comes through, especially with our sexual health, is you need to wait, you need to wait, you need to wait till marriage. And I think that is such a beautiful thing if you do decide to do that. Now, the issue comes whenever anything sensual becomes demonized, especially when it has to do with natural bodily functions that God gave us. And I think it's so important to note that that doesn't just go away when if you do wait, for marriage. Oftentimes, after you jump the broom, another message that can come is, when are you going to have children? When are you going to have children? When are you going to have children? And there's a ton of pressure and a lot of psychological distress that can happen with that whiplash effect from don't ever think about it to do it all the time. Also, give me a grandchild. So that can be quite distressing, especially as women and as vagina uterus owners. All right. Um, we're going to talk a little bit about the vagus nerve. Vagus nerve is it. Oh, I'm so sorry. My dog is trying to get in on this session. All right. The vagus nerve can become impaired. The vagus nerve actually helps with our parasympathetic response. And that's just a really, really big word for it helps our body go into that calm state. Now, when the vagus nerve is impaired, it can disrupt the body's ability to actually relax. And this can lead to your body staying in that fight or flight response, that sympathetic nervous system response. Chronic stress, we got that cortisol, adrenaline, digestive issues, pelvic tightness, and pain. And so it's so important to understand that it's not just affecting you from an emotional, psychological level. It's really affecting every part of your body. All right, let's go to the next slide. All right, so we're going to talk about the domino effect. And I kind of talked a little bit about it, but this is going to kind of bring everything together. All right, psychosomatic effects. And we all know that word now, psychosomatic. So we're going to create a little bit of a story. Now, this is not always a domino effect for every individual, but this is something that I see often in my practice. All right, fear-based conditioning and muscle guarding. Fear or shame around the body or our sexuality can increase our subconscious muscle guarding. Have you ever been kind of stressed or watching maybe a horror movie and your neck your shoulders kind of go up a little bit? And you don't even realize it. And then someone taps you on the shoulder and says, "Hey, you're really, really stiff right now. Can you relax your shoulders?" And after that, you're like, "Oh, I didn't even realize that was happening." That is a form of muscle guarding, where our muscles protect us without us having to really ask it to, because our subconscious mind is always on the alert. Remember, it's always on alert for those threats. So it's saying, "Ooh, I'm going to protect them so much. I'm going to do my job so well. They're going to love me." Let's go to the next one. Our nervous system can become dysregulated. Now, this is quite an important concept because our body is very good at its job. And sometimes when it becomes very good at its job, it does not allow the central nervous system to process through those negatively deemed emotions or sensations. Okay, so let's go back to that horror movie idea. If I saw the horror movie and I'm kind of like getting tight, my body is taking on the stress. My body is tensing up to make me feel a little bit more comforted. If I do not allow my central nervous system to actually process through those negative sensations, whether they're triggered memories, emotional sensations, psychological sensations that are not really good, or they're filled with guilt, shame, things that we don't really want to feel, so we suppress them. If our nervous system is not allowed to actually process through that, imagine like it gets kind of clogged up and your nervous system can become dysregulated. Now, this is a very important concept because in order to heal from religious trauma, we have to address our nervous system and help it regulate properly. Okay, let's go to the next one. Emotional numbness. Just like that dissociation we talked about, that suppression, as we numb those emotions that we may feel are dangerous, not good, or our body is just so good at its job that we don't even have to think about it, it just kind of suppresses it for us. In time, the body may shift into a freeze response. This can look different for a lot of people. It can look like sitting on the couch for hours and just kind of being there, not being able to move much. It can be being frozen whenever you get triggered. Everyone's a lot different. Everyone has their own coping mechanisms. But a freeze response is the body's way of coping, right? This can lead to a dissociative state, can lead to a numbing effect. Now, when we talk about sexual health, this concept becomes very obvious. And I hear this all the time. When someone is trying to engage in penetrative intimacy and even non-penetrative intimacy, anything where they have to be vulnerable, let their walls down with a partner. And oftentimes, if we have a dysregulated nervous system, if our muscles guard to protect us very quickly, our body can also freeze or dissociate from what's going on in our body. So a lot of people say, whenever I'm engaging in intimacy, I just don't really feel present. I kind of feel like I'm watching myself from outside of me. I feel like I kind of don't really know what's going on, or it goes quickly and I don't remember. That's our body's way of coping. That's our body's way of protecting. It's trying to do its job so good that it's kind of hurting you. This can also lead to genital numbness. Oh, so sad. Those nerves that we talked about that are down at the pelvic floor, that are around our sexual organs, they need to have sensation. And when we call it um what is it called? Dissociative analgesia or something. Cannot remember. DM me and I'll post it on my page just to make sure. And I apologize for not remembering. But that genital numbness can lead to a lot of things like anorgasmia. And anorgasmia kind of sounds exactly what it means: the difficulty or impossibility to reach orgasm, which everyone should be able to experience. So that's very unfortunate for a lot of people. All right, a sense of detachment from the pelvic area and sexual organs. Okay, let's go to the next one. Inflammation and immune system activation. Sometimes people don't notice or realize all of these until it gets to this. Then they start noticing the big changes. Your immune system starts getting activated. Your inflammatory levels are increased. What does this look like? This can look like IBS. This can look like interstitial cystitis, chronic fatigue, fibromyalgia, chronic pain. This can look like pelvic floor dysfunction. This can look like so many different things because those inflammatory markers, our body is just more inflamed than usual. Because remember, our mind, our body are connected and they affect each other. Okay? All right. All of this can lead to long-term health complications. So the culmination of all these things can lead to health issues, pelvic floor dysfunction, chronic pain, and emotional challenges. So I want you guys to kind of see how this domino effect goes all the way to a point where it's really negatively impacting your life. And we need to break that cycle. I think it's time that we completely break that cycle so that you don't have to be in that cycle anymore. And not only that, you can also spread the word so that other people and other women don't have to experience such a terrible experience anymore. It's their body. It was made so beautifully and wonderfully. And it's important that you feel confident, empowered, and connected to yourself and to those areas that we oftentimes can demonize. All right, let's go ahead and just go straight into how can we actually heal this. We talked all about the problems. We talked all about, okay, what's really going on, but let's get to the good stuff. How can we fix this? So healing the physical, neurological, and psychosomatic. We need to restore the balance to our nervous system, right? Healing requires retraining the brain and central nervous system to shift out of a fear-based pattern into a state of safety and relaxation. So we need to address the root cause of trauma. Oftentimes, a lot of people say, let me just get a massage and try to relax. For vaginismus, and vaginismus, when penetration is painful or impossible, some people say, oh, just drink a little wine and relax. Smoke a little bit of something green and relax. And that's not really getting to the actual root cause of the trauma. So identifying it is so important, more important than you think. Okay. Also, regulating the nervous system, pelvic floor therapy, trauma informed care for my pelvic floor therapists and physical therapists alike. And this can help you break the cycle and actually heal. We're going to go to the next slide. All right, lots of blocks. Let's go ahead and read one block. So this slide is about regulating the nervous system. How does one actually regulate the nervous system? And I think this is so important because for many generations, there might be a disconnect when it comes to how to properly regulate yourself. Sometimes you might learn it midlife and see individuals who are older than you not being able to at all. So it's a skill that you can learn. All right. One thing that is so slept on is breath work. And oftentimes, whenever we're crashing out, whenever we are getting real stressed, we have that chronic anxiety, and we hear, just relax. We want to flip the table over. But really, it's a tool that you can use. So, breath work is actually a tool that can unlock a locked up nervous system. And there is a reason for that. We talked a little bit about the parasympathetic nervous system, the vagus nerve. There's so many, I could talk about this for hours. I do actually talk about it for hours. But we're going to just get to the nitty gritty. Breath work is such an important thing because it can actually get us out of that loop of fight or flight. It can tell our body and our nervous system that everything is safe. We can rest. It also does a few other things. It allows the diaphragm to actually function correctly. And that diaphragm is going to help pump a lot of blood circulation around the body. It's going to help with regulating your nervous system, bringing blood flow to those nerves that might be a little bit more sensitive. Oxygenated blood as that of that. All right. It also is going to help stimulate your vagus nerve as well. It's probably one of the easiest ways that you can stimulate your vagus nerve because the vagus nerve runs down through it. Okay. Grounding techniques. Have you ever heard of someone say touch grass? Well, they're really just trying to, well, you could touch grass and it's actually quite relaxing. I would definitely, I want everyone to do that today for sure. But grounding techniques is really just a way for you to be present in your body. And what that can look like is being a little bit aware, being mindful of how you're breathing. Some people breathe like this. And that's not the best breath work. That's breath work that's great for whenever you're in fight or flight and when you really need to be ready to run from the bear. But if we're mindful about what's going on, the sounds around us, what we're seeing, the sensations touching fabric, sensations on my fingertips, right? If my belly is expanding, all those things are grounding you into the present and outside of the what ifs and outside of that loop that we talked about. All right, trauma informed therapy. This goes for both my therapist and the people who aren't in healthcare at all. Everybody should experience therapy at some point in their life. I think it's something just as important as going to the dentist. Trauma informed therapy provides a safe, compassionate space to actually process through religious trauma and just generalize complex trauma correctly and in a healthy way. Sometimes not every environment is a safe space, and that's unfortunate. So, going to someone who understands how to provide trauma informed therapy is important. And physical therapists should also understand how to provide that as well. It's also a really great way to reframe harmful beliefs and reconnect with the body without fear or shame. All right, we already talked a little bit about vagus nerve stimulation. There are so many other ways to stimulate the vagus nerve. This is like a quick thing that you can do. There's so many other things you can do to help calm yourself, but this is something that individuals can also do. Easiest way, is expand your ribs, open your diaphragm, breathe in your belly, diaphragmatic breathing. Another way that's kind of silly is actually putting your fingers in your ears and pushing forward. That can actually stimulate a little nerve that's around this area that's also connected and associated with your vagus nerve. So there are a lot of different ways. Rhythmic movements as well, um, rhythmic shaking, tapping, and that's going to lead us to the next one, EMDR therapy. So EMDR is eye movement desensitization reprocessing. This is a tool that a lot of therapists can use and teach individuals to help process complex trauma or PTSD. Now, we already talked about religious trauma, how it's quite related to PTSD and complex trauma. So EMDR might actually be a game changer for you. I have so many clients and patients that have used EMDR to help with their urinary incontinence, their urgency, their vaginismus, and actually saw a very quick, almost immediate improvement just from using EMDR. If you're going to do this, definitely actually talk to someone who's trained, talk with your therapist, and discuss to see if it's actually a right fit for you, because not every tool is the best for everyone. So it's very important that you research this. All right, let's go to the next one. My favorite slide, the pelvic floor and trauma informed care. And I love this because it's what I do all the time. I'm really good at it. And the reason why I love it is because it helps so many people with complex trauma whenever it comes in the form of pelvic floor disorders. So help to release tension, restore function, create a safe, compassionate space for healing. Pelvic floor therapists are trained with trauma-informed care. And you can heal from those physical and emotional effects of religious trauma, especially whenever it can show itself with urinary issues, sexual issues, pelvic floor dysfunction alike. So manual pelvic floor therapy helps release the sore trauma from the muscles. I would like to note that, remember how I said the body and mind are quite connected and you can't really take one away from the other? Well, these muscles have so many nerves inside of them that go to the central nervous system to relay information. So if a muscle here is constantly locked up and tight, and is triggered, that tension is triggered from fear, guilt, shame, embarrassment, that's going, that's going to inform your central nervous system that you're not safe. So one way that we can actually help calm the nervous system and also help desensitize these nerves and muscles are by releasing the tension that's already being stored there. And that can be with gradual exposure therapy. We're going to go to that in a second. When we look at dilators, dilators is a form of manual therapy that helps with gradual exposure. So a little combination of two. All right, gradual exposure therapy. I love this one because you can do it right now. You literally can do it just by thinking about your pelvic floor. You are exposing yourself, right, to that area. When we think about our pelvic floor or the muscles around those areas, or we think about tightening them or relaxing them, that part of your brain that controls that area also lights up a little bit too. So just by thinking about it and telling yourself you are in a safe space will actually help gradually expose you to feeling safe using them. Okay. Safely reintroduce touch and pleasure without triggering that fear response. EMDR can be used as a gradual exposure therapy. Sensate focus. Sensate focus is a really great way to gradually introduce touch and sexual pleasure in an intimate relationship in a very safe way. We're going to go to the next one that is incredibly important, and you are receiving it right now. Pelvic and sexual education without fear. So learning. Empowering yourself with knowledge. You are actually doing that right now. So that's great. You get a gold star. I'm so proud of you because you're doing something so great for your body. You're learning accurate, shame-free information about your body and about pleasure. You're learning it knowing that, hey, This is a normal thing and it should be normal for me. Just like I put my hands together like this, I should be able to touch down there without shame because it's me. It's a part of me. Why would I be ashamed of something so beautifully made? And the next one, mindful movement. So pelvic floor therapy and trauma-informed care. If you think about a therapist, you might think about exercising and stretching. Well, I love exercising and stretching because everything we just talked about can kind of be wrapped up a little bit in exercises and stretches that are made specifically for you and the goals that you want. So if you get your exercises and you have your personal tasks, do them because they're going to help. They're going to help reconnect you with that pelvic region and also reshape that internal narrative, reshape your thoughts, your belief systems about your own body. That is beautiful. That's beautifully made. That is normal, that you're not broken, right? And that's going to help reduce that fear and that shame. All right. So, in conclusion, I want you to reclaim your body. And when you reclaim your body, reclaim your power. Even if you didn't think the power was even there to begin with, oh, you have so much power. Your body is literally so powerful that it's doing its best to make sure that you feel safe and your own body. And sometimes it can be misguided by tensing up, storing trauma, storing areas and tension in places so that your mind doesn't really have to deal with it anymore. So when you allow your body to actually just be and you accept that, and you actually do what we talked about in this presentation, you are allowing your body to have a big sigh of relief and said, "Oh, thank you. I worked so hard for you. I did my best. Thank you so much for taking off this load and allowing me to rest and allowing me now to be listened to. Thank you for listening to me so that I don't have to be struggling and working so hard in silence. Thank you." So when you reclaim your body and your power, you are giving yourself such a huge hug and you're giving your body the ability to sigh with relief and say, okay, I can rest now instead of being in fight or flight all the time. All right. Healing from religious trauma is not just about undoing the past. It's about reclaiming your body. It's about processing what happened in the past, processing those emotional responses that we have oftentimes suppressed, gaining back your autonomy, and your right to experience pleasure, connection, wholeness without feeling guilty, well, without feeling sinful, or without feeling that shame. So I want you to read that line, "You are not broken, and your experiences do not define your future." This whole presentation is because you deserve support. And also, it's very important that you give yourself grace and know that healing is an ongoing journey. So read that all over again because it is a journey. Everyone's on it. You're not alone. You deserve support. And honestly, watch this whole thing over again so that you can remember that over again as well. All right. I'm just going to do a shameless plug. These are some of my client feedback. Some of my clients who have worked with me have regained their body autonomy, have regained their confidence, have regained their power, and they have noticed a change. So it's not so far fetched or so far away from you. It's literally right here. You can go and grab it. And I do one-on-one pelvic coaching, create personalized program. And I also think it's so important that you find what fits for you. The only part that you have control over is taking that step. Sometimes it's so scary because we don't know what's on the other side. And our body is so afraid to be disappointed or being afraid or experiencing harm. But taking that one step forward is going to be probably one of the best things that you can do for your body. And I want you to know that you're not alone. You have support. And if you want to take that step, you can always contact my pelvic floor muscles, my pelvic floor academy, or me, Vagina Plus Me. And so you're not alone at all. You're not broken. And this is something that is within your reach and it's right there. All right. Thank you so much. we're going to open up the floor for any questions, and I'm going to give it back to you.
Thank you. That was amazing. I do have a question.
Okay.
So you talked about earlier that, patients may come in and they may be aware that they have this trauma and where it comes from. How do you, or do you just kind of refer this out on your scope, but how do you kind of lead them to the way to realize it is from a religious trauma
Mhm.
without getting too deep into like something that's outside of our scope?
Yes, yes. So I think that's so important because oftentimes um, people come to pelvic floor therapists as their first source of help, and they don't really go out to everyone else. They may come to us because they want someone to advocate for them. So it's
Right,
so important to really, really listen and listen in between the lines. What that can look like, whether it's religious trauma or complex trauma with a religious component, is to really listen to the goals of the patient, listen to some of the problem areas of your patient, and understand that sometimes all that information you're going to get in between the lines.
right,
Now, whenever you are working hands-on or even online, because I work solely online with a client, it's really important that they understand how to be mindful with their own experience as well. Every single time I have a client, I always refer them to a mental health therapist, mental health care, or I refer them back to their own psychiatrist or psychologist. And I always love working together because you can do so much whenever you have hold hands with their other partner or their psychologist or their mental health therapist or whoever is their support system. So understanding is really, really listening, especially whenever you have that first interview, that introductory period, understanding what their goals are, and also helping them to be mindful and advocate for themselves when some things come up. I also think it's very important, like with pelvic floor physical therapy, sometimes it's hard to really identify exactly if it's religious trauma or just complex trauma, and there's this big knot of trauma, basically. So, being mindful of that, using trauma informed therapy, and guiding the client or the patient in a way that won't be psychologically harmful or distressing for them is very, very, very important. The biggest goal is not just to pinpoint if it's just religious trauma or if it's this trauma, because that's not in our scope of practice. It's really to guide that client to regaining function, regaining control over their body, and helping their nervous system, their nerves process through whatever's going on. And if they do realize it's religious trauma, diving in with their mental health therapist or their psychologist to really be able to bridge that gap, because we are our patient's main advocate sometimes.
right. Agreed.
Hmm.
Thank you. Any other questions? Mm, okay, I think we're good. Thank you so much. That was so amazing and so positive. I felt very empowered. So I think
Oh,
you
good, good.
have a blessing and a skill and a way to reach out to people and touch people. So keep doing
Mhm.
amazing things. We are so thankful to have you.
Yes, thank you so
All
much.
right, have a good night.
Good night.